Hello everyone, I'm Dr.Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Today I'm going to answer a question asked by our viewers. What is zero sperm count and what can be done when the sperm count is zero? So zero sperm count is commonly known as azoospermia, which means there are no sperm seen in the semen sample. So first of all, I would tell you few important things to make sure that your report is correct. First and most important thing is you should get it evaluated only in a fertility center because their andrologist will be preparing the semen sample as per the WHO guidelines and screening it manually for the report. So it is important to get it done from a fertility center. Second important thing is make sure that you have a proper abstinence period. 3 to 5 days is the ideal abstinence period. Having less abstinence period might reduce your semen volume and count. Having more abstinence period may increase the percentage of dead sperms in the semen sample and may also affect the motility. So make sure that your ideal abstinence period 3 to 5 days when you give the sample. Third thing, preferably give the sample only in the fertility center where you are getting the test done. Avoid doing home collections. We might miss out noting down certain parameters when you do home collection and even the report may not be reliable. Also, another and most important thing I would like to say is most of the times we come across men visiting a fertility center alone and getting their semen analysis done. And if by chance they find any problem in that report, what they do is they tend to avoid consulting further, but they visit multiple centers just to check the semen analysis, or they tend to go for some non-proven treatments like herbal medicines, acupuncture and whatnot. So what happens in this is we might lose the peak fertility period of women's life, which is between 20 to 30 years, the initial time of marriage, and the patient as a couple comes to us quite late when the woman's age has already crossed this ideal fertility period, sometimes even after 35 when there are hardly any eggs or even the egg quality has compromised. So what happens in such cases is even if we do an IVF with the husband's sperm taking out through TISA, the resultant embryo may not be good or we may not get enough embryos for transfer because egg number has reduced by the time and the quality is compromised. So if you want best fertility treatment outcome, it is always advisable to consult a fertility specialist and not visit as an individual or not visit only andrologist or only gynecologist where they will do only individual assessment. So when we do the complete assessment of the couple at the same time, we can advise them for the treatment. Also, when your sperm count is zero, then we advise to do certain tests. These can be hormonal evaluation, genetic evaluation, ultrasound. So whoever requires the test, we write these tests with the test reports, then we discuss it with the couple what are their possible options for treatment. So these options could be taking out the sperms from the testes, which is called as TISA, or can be PISA, which is epididymal sperm aspiration, or it can be micro-TISA. So based on these options, we explain the procedure to the patient. Most of the times, TISA sperm or the sperms which is taken out from the testes is used only in IVF because these sperms are not in millions. They are very few and also they are immotile. So they cannot do the fertilization on their own. So patients who have azoospermia, what we do is after complete evaluation, we plan the couple's IVF cycle. Wife stimulation goes on simultaneously when husband also might get treated with sometimes hormones or antioxidants and vitamin tablets to improve the sperm parameters. And when we do the egg pickup on the same day, we plan husband's procedure to take out the sperms from the testes. These testicular sperms are then injected into the egg to prepare embryos. So this is about azoospermia. Sometimes there might be some causes of azoospermia where we may not get sperms in the testes also. Such patients, we counsel them for donor sperm. So even some patients, if they want to try the cycle along with TISA and if they are willing to have a donor sperm sample standby, we counsel them accordingly so that we don't have to decide on the last minute whether to throw the eggs or whether to freeze the eggs if we don't get sperms at the time of TISA. So all this counseling also happens when the couple visits us with all the reports so that they are mentally and financially prepared for their journey. So I hope this was helpful. It is very important not to lose your peak fertility time and not to consult individually only to andrologist or gynecologist, but as a couple to fertility specialist so that you can have best outcome from your situation. I hope this was helpful. Thank you.